Kia ora everyone. Welcome to the first iteration of the 2025 Social Sustainability Committee drama as an ongoing committee for the welfare of the Kapiti Coast. Great to see you all. Hope you had a fantastic break. I hope you're not going through the same rigmarole I am of just trying to get cranked back into the new year. But hopefully everyone had a nice break, fully recharged and coming into a new year, which is obviously going to be an eventful year with an election and all the other things that are going on at the moment. We'll start off the council blessing. Johnny.
Okay, as we deliberate on the issues before us, we trust that we will reflect positively on the communities we serve. Let us all seek to be effective and just, so that courage, vision and energy, we provide positive leadership in a spirit of harmony and compassion.
Fantastic. We're just going to apologies. We've got Mayor Janet Holborough and anyone else offering an apology that we don't know about? No, if I could have a mover for that. Rob, seconder. Kathy, fantastic, that's passed. Morag here just wants to do a little bit of housekeeping with regards to the start of the meeting. I'll pass it to you, Morag.
Kia ora koutou. So just a note that we want to make at each of these meetings going forward. The Social Sustainability Committee considers matters across health, education, justice, housing, community connectedness and resilience. So to enable full and transparent discussions across these areas, topics may be raised that could be sensitive to some viewers. We encourage meeting participants to be mindful of this when discussing these matters, and for those viewing to use their discretion. Participants within the room are welcome to choose to leave the room if a topic of a sensitive nature is discussed, and those online are able to leave the live streaming and return when they are comfortable.
Thank you, Morag. Number 4, we've got any declarations of interest relating to items on the agenda? Going once, going twice. Nope, that's great, thank you very much. Public speaking time for items relating to the agenda. I haven't had anything come to me. We don't have anyone out there. Nope. So we'll move on to deputations. And Ian, I see you've come to the table. Thank you very much. Ian's a representative from the Kapiti Health Advisory Group and one of their subgroups, which is accessibility. And he's just going to give us a quick update on the compelling case around the polyclinic. And then we'll be having the rest of the deputation presentation from Sandra and Don Hun, which will be talking about community health. So Ian, the floor is yours. I think you're doing a PowerPoint presentation as well, is that correct?
That's right.
Fantastic.
Yeah, and but I want to say a couple of things before I get on to that. But first, I just want to acknowledge the honour I have in being here in terms of being Don Hun's warm-up act. I've never had an accolade like that before, so thank you very much. Look, what I'd like to do first before going through the PowerPoint, which as I said, was quite short, is just to make some initial observations for a bit more context. And the first thing is to try and summarise very concisely what we're actually seeking to do. And we're seeking to do essentially two things interconnected. The first thing that we're seeking to do is to expand the services currently provided at Health New Zealand, or Te Whare Ora's Kapiti Health Centre in Paraparaumu. And the biggest two areas of that in terms of expansion would be 24/7 urgent care and also expanding the number and range of outpatient clinics that are provided there by specialist doctors and by allied health professionals and nurses. The second thing flows on from that is to, over time, expand them to a sufficient level that hands on heart, it could genuinely be called a polyclinic. Polyclinic in the sense of covering many services that straddle the divide between community care in the community, and care that would be provided in hospitals of a non-acute, non-emergency nature. So in terms of the impact of that on the area, that would not pose any threat or any undermining to any of the services currently provided. It would be additional to those that are currently provided within the wards of this council. Paikokariki, no threat there. Low base, of course, because very little is provided there. Raumati, no threat there. Those services continue. Paraparaumu, likewise. Waikanai, likewise. Otaki, likewise. Otaki is a little different in the sense of when it would start to potentially benefit from the expansion of services because of the referral relationship that exists between general practices in the area and Palmerston North Hospital. But over time, there would be the opportunity to expand if it makes good clinical sense to do so. So I just wanted to deal with that one. And the other one was just the current phase. Now, this initiative is rooted in the consultation process that occurred before, leading up to and following the 2018 petition that went to Parliament. It's essentially seeking the same thing in terms of the expansion of services at that Health New Zealand facility, then a DHB facility. What we're seeking is to, when I, as most of you know, I worked in and around the health sector for about over 30 years, and one of the things I learned was the distinction between consultation, a very formal process, and engagement, a much more proactive, interactive process. So while we are rooted in a consultation process that began about health services, in fact, if I was to say, are we going through a consultation process now, the answer is no. I won't leave too much of a pregnant pause on that because what we're talking about is an engagement process in which we seek community awareness, not just awareness, because I think the awareness is there, but we seek actual engagement because at the last presentation here, I put up a slide about Karl Marx on struggle. And it wasn't just to titillate Councillor Wilson, it did that. But there was another objective to emphasise that there is an ongoing struggle to achieve this beyond actually supporting going down this path in terms of engagement with Health New Zealand. And we cannot do that without active community support. And so that's the process that we're picking up from the earlier consultation process and drilling down deeper to make sure that happens. Now, I can manage that. First of all, stakeholders. Now, the thing about the stakeholders, I don't always like the term stakeholders, but it's there, we have to use it. But this is, most of the stakeholders that are listed there are essentially providers of health. The latest version of it, which is called Mark 6 or version 6 of the compelling case, has gone out to all the general practices. Went to the Otaki ones first because they have a different PHO and they did it quicker. But it's gone out to all the ones south from Peka down to here, Raumati. It's gone to the others there, Kapiti Youth Support, Mary Potter, Wellington Free Ambulance, Mobile Health. That's the surgical bus that comes once every 6 weeks up here. And this is, again, the relationship difference between consultation and engagement. With those bodies, what we've been doing is not simply saying, do you agree, but having discussions with them and some good constructive discussions, including just as recently as with Free Ambulance and also Mary Potter, how we might collaboratively work together with the expanded services in this facility to help both what those services are providing and what they are doing. We want to integrate in a collegial way as much as possible. And that's part of the engagement, to get their input and their advice and their direction on how best to do that. Mary Potter provides palliative care, daycare only. They see potential scope in this. If the facility expands into the area of healthcare for the elderly more, and particularly in palliative care, there's a good opportunity for improving the services, the opportunity and the quality of palliative care, both in that facility and in their facility, and collaboration between the two. Enormous scope for collaboration with the Wellington Free Ambulance, the way their paramedics actually provide extended care outside the ambulances, actually in other facilities. So there's enormous potential here. Digital Health, that's the national infrastructural body for health IT nationally. Their chief executive is a resident here. They see considerable scope. They're more of an enabler, not a provider, but a critical enabler, they see enormous scope in what we are doing, or what we are proposing, I should say, in terms of expanding services there. Both the main parties are very supportive of what we're doing. And the other challenge is Te Whatu Ora, Health New Zealand. And in an earlier presentation, I described it as trying to wade through thick treacle. Well, we've put our toes into the treacle a bit. And we're actually getting quite good when we can talk to the right people, and providing they're not restructured out of the organisation too long after that conversation, of getting some good sort of, we're socialising it with them. We're not saying, how do we plan it? We are getting them used to the idea that should a council eventually agree, we're well placed to get traction there. A coincidence is that the first person I spoke to within Health New Zealand, who I knew well, at the second tier of that organisation, a former chief executive for the Waitemata DHB, I floated the idea of what we're planning with him. He then triggered off some discussions elsewhere, and that was good. Coincidentally, he's now the new acting chief executive of Te Whatu Ora. You get a sense of the turnover. So all those dynamics are looking, without commitment and with still lots of treacle there, they're looking promising.
Sorry, Ian, can I just ask a question on your the stakeholders? Is the newly formed housing trust, or any of the housing agencies, are they part of the stakeholder, just because housing's such an indicator?
Short
of
Sorry,
answer.
I'm just going to stop in there. Ian, if you've got a question, can you please direct it to the table, because I can potentially answer that one, rather than asking somebody who's perhaps
Is
not
it possible
tied
to
into it.
have them at the end?
Yeah, sure.
Yeah. Look, these are the we've got now meetings with all the community boards. The Otaki one is slightly different. It's not a they don't have a formal scheduled meeting within the framework, our time frame, but they do have an informal meeting. And so we've got the first one tonight in Paraparaumu here. A little competition with the Somerset issue. I happen to be an Otahanga resident myself, so I'll probably be at the entire meeting. But anyway, we'll be having presentations with Sandra Daly and myself to all of those in the order that you see up there. We're also looking at public meetings. This is a little bit, Sandra has been following through and making arrangements, so there are some dates there now, but looking at having them in a couple in the area where the greatest critical mass of the population is, Waikanai, Paraparaumu Beach in terms of Raumati to Waikanai, Peka Peka, Te Horo, but also Otaki and in the south, Paikakariki. We have, you've seen these before, so I won't go through them, but there are essentially well, not essentially, that's tautologist, but there are two recommendations. And the operative words in that is a joint memorandum of agreement between the Council and Health New Zealand to incrementally expand the services at the Kapiti Health Centre. Not overnight, because it can't be done overnight. It's not a business case. Business cases could follow from it, such as urgent care, for example. And so that would then, so the objective is to provide an integrative healthcare service, which is essentially what a polyclinic is. And the second recommendation is the emphasis there is on co-design and co-planning between Council and Health New Zealand. Now, in both those processes, Health New Zealand would have the strongest statutory say. But there is a difference between power and influence, and sometimes I think influence is more significant than power because you don't see it coming as well. So, but nevertheless, it's a process based on engagement between two statutory bodies. Now, this is the time frame that you can see there that we're looking to bring this, because there has to be a beginning, and we've had that. There's a middle, and we're coming towards the end of that, and there's an end of this process. And so we're looking to present a final the final proposal for deliberation and recommendation to your committee on the 8th of May, with a view to having it going to the council on the 29th of May. That's obviously your committee and council have to agree to that time frame, but that's what we're proposing and organising around. And essentially, that's when if you like, the foreplay ends and something more climatic starts in terms of the engagement, if it's approved, with Health New Zealand. It flows on from that. A final comment is just, it's about swimming. I swim fairly regularly at the Kapiti Pool, great facility, and I go there at 5:30 in the morning. I do about 30-odd lengths, and during those swims, I managed to solve most of the problems of the world. The problem was that when I get out of the pool, I've forgotten the solution. However, this morning, I confined myself not to the problems of the world, but to the lower scale level, which meant that I could remember and still do now. And that was the question was, what would be the reasons for not agreeing, opposing what we are proposing? And I could come up with two. The first one, only two. One was that we don't want to, we don't want to expand health services at the Kapiti Health Centre. And then while I was swimming, I conducted a scientific poll. And the poll was probably as accurate as the Taxpayers Union Curia polls. And what it essentially came up with is that we had an adult population of residents of, say, 45,000, non-children. Then probably my estimate would be, based on the scientific poll, would be of that 45,000, 44,900, somewhere between 44,998 and 44,999 of those 45,000 people would support the expansion of services at the Kapiti Health Centre. Now, the other argument could be KCDC should not be involved in advocating for the expansion of services at the Kapiti Health Centre. And in the context in which I've presented it, which is the context in which it is being developed, about expanding services, and that not at the expense of existing services or service providers, but wherever possible in collaboration with them, if it was opposed on that basis, then in fact there'd be no point in actually having the advisory group that you've established, KHAG, because what would be the point if something as basic as that was not supported in terms of advocacy? And it would beg the question of why in fact have a health strategy, which the council itself is going through a consultation process to develop, because there would be no point. It's something that is actually synergises with the draft health strategy. So I'll just leave it at that. Happy to ask any questions. Happy to answer any questions. I'll ask them as well if you like, but happy to answer any, and particularly where there are concerns about our direction of travel, our engagement or consultation process, or anything else, including swimming.
Excellent. Nigel, did you have that question that you want to put forward? Well, what's the question? I didn't really hear it. Sorry, Jackie.
Sorry, the question was just in terms of stakeholders, I didn't see any reference to any of the housing, like the Housing Trust or any of the housing agencies. I was just wondering if were they a consideration?
The issue of housing is a consideration. The issue of the stakeholders, not really, because we're volunteers, and this work is overwhelmingly done by volunteers. We've got, Martin's been a great supporter, Kathy has been supportive, our council staff have been supportive, but the grunt work is actually done by volunteers. So we would be happy to engage, definitely, but we don't have the networks to make that kind of contact.
Okay, and the other one I noticed was Wellington Free Ambulance is one of the stakeholders, but as far as St John Ambulance, they come down to. So Wellington Free don't operate in Otaki, right? I think
That's
it's-
right. That's right. That's the historical thing. It's the same reason is that patients from Otaki are referred more like, well, except in exceptional circumstances when they're referred to hospital cares, go to Palmerston North. So we haven't really engaged. If because we have they don't really, except again, apart from exceptional circumstances, come into Kapiti South.
Okay.
I think the other aspect too, Nigel, is the geographic positioning of the ambulance being right next door to the centre as well. Jackie. Oh, sorry, Lawrence, I'm
Ian.
one behind everybody.
That's all right. Thank you very much, Ian, for the update. My questions are very similar to Councillor Wilson's. St John's Ambulance, to me, would be quite an advantageous networking partner on this. And I say that as an Otaki resident. And also, I wondered why iwi were not on the stakeholder list.
Look, I might let Martin handle the iwi question. But on the first one, though, because we were advised that council would be best to do that, right, council staff than ourselves. But on the first one, at the point when if it goes ahead, and at the point that we have a facility that has expanded, services have expanded enough for it to be of relevance to Otaki people being referred here, then obviously there would need to be a good engagement with St John's. Yeah.
And obviously developing the relationship with stakeholders is an ongoing exercise. Council officers and council have a relationship with Mana Whenua, but this is sort of a bit outside that as well with regards to not being a council, should we say, deliverable, if you like. So there's been a little bit of sensitivity in that space. Certainly KHAG's or Kapiti Health Advisory Group's open to any engagement in that space like KCDC is, and they're building relationships in that space as well. Hopefully that will, well, not hopefully, that will develop in a stronger way as we move forward as well. Sorry, Chris, you wanted to make a comment as well?
Thank you. I just wanted to add, as just a bit of context, we continue and have been really focused on starting to more formally set out our health system, our ecosystem of key parties, and two of those parties are our iwi Māori partnership boards, and we are bringing them into conversations and starting to get a more formal process of engaging on things related to health with them, as well as Health New Zealand and the Ministry, or though Ian has talked about some engagement in that space already because of the nature of the work that's progressing. We haven't had those relationships, so we're just starting to bring that into play, and that is part of how we're cycling through. And that's not to say that there isn't an intention to engage on topics. It's just in a very staged way that we're bringing a picture together. And in the interim, you're obviously hearing from Ian about the really good work that's progressing to get us to a stage that we can actually engage on something, I'll say a bit more substantial, rather than it being an idea. It's really starting to get some legs.
Kim.
Yeah, I just wanted to comment, just in terms of iwi engagement. So through these forums, we keep the things like Tupunoranga, our iwi, engaged, and we let them know what's going on. And KHAG has reached out. It's just a matter of kind of timing, I think, in terms of trying to get that package together and things that we've got going on. But we're definitely open to that relationship when the time is right. And they definitely, even though we're not listed as stakeholders, they definitely have an interest in engaging with us. So that relationship is forming. We just haven't kind of nailed that yet. I'm not too sure what's happening in Te Atiawa space, But for us, we're definitely keeping a keen eye, and because to us, the collaboration part of it, that's the key for us and for Otaki to be able to collaborate and where those services go. So just wanted to mention that, that's all.
Yeah, that's good. That's great.
Rob,
Oh, thanks,
Oh.
Martin.
did you want to comment? Sorry, Ian?
Well, I just want to say thanks. I pressed the wrong button.
Cool. Rob.
Thanks, Martin. My light's gone red. Ian, I just noticed from Old Taki to Paikokariki, we have a big problem. We have elder doctors retiring and younger doctors not leaving for overseas, and there's a doctor shortage. In fact, the Waikanai branch, one Waikanai branch of their medical centre actually closed down due to lack of doctors. Have you thought of any initiatives to attract the younger, brighter people into the area to take over?
Sorry, I'm going to sort of put a hold on that question. It's a little bit out of topic with regards to what we're talking about. I hear what you're saying with regards to general attraction from a general health perspective. This is a specific update on the access with regards to the polyclinic.
I think it's
Sure.
very valid. Sorry. Yeah.
Look, well, in my past life, I've been banging on about precisely that issue for a good decade or so. There's a pay gap between specialists in New Zealand. There's a pay gap in the economies of New Zealand and Australia of about 25 to 30% the other way. For medical specialists, it's about 65%. So it is a real problem. That is going to be a major constraint on our ability to actually, if even with the best will in the world and Health New Zealand comes to the party and we go down the aisle arms linked, even with that, it's going to be the shortage of specialist doctors, general practitioners, but also across the health system in terms of nurses and other and allied health professionals that will shape the progress that can be, the expansion that can be made. And that's beyond our control. There isn't a particular initiative that can be done to bring doctors specifically to Kapiti. I note with fascination that in Otaki it seems to have been done through Facebook, and I quite admire that. I don't know quite how it happened, and I'd love to know. But as a generalisation, there's not a particular thing that you could do to bring someone to Kapiti that other parts of the country could also not do as well.
That's why we want to make Kapiti the coolest place to live.
Well, it is.
Suka.
I think I just also wanted to say that in terms of that, a bigger deterrent for people is the cost of housing. And so this is not super relevant, well, it kind of answers the question, but it's also a thing that we should factor in when we're discussing the next item relevant to housing and see how those things are linked, and that having more housing will increase the amount of doctors and the health of people.
Well, hopefully our Community Land Trust will take a specific pathway potentially for providing housing in that space, which would be fantastic as well. But thanks for bringing that up. Okay, Ian, thank you for your very brief update. But no, very informative. Thank you very much. Much appreciated. And look forward to hearing you tonight at the Paraparaumu Community Board as well. Look, I'm sure there may be opinions on both. Sandra and Don, please come up. Would be much appreciated. And don't stress out about time. As such, we don't have a heavy agenda, so there's less leeway there. Kia ora. Welcome to the Social Sustainability Committee. Kia ora, Don and Ron. And the floor is yours.
Kia ora koutou, and thank you, Martin. And thank you for inviting us here. And if Ian had problems being the warm-up act for Don, imagine how I feel being the sandwich between the two of them. However, I will be brief. Just to let you know that we came to you with a work program about this time last year. We had a planning session earlier this month when we had a look at all those things that we sought to do, tracked where we're at with all the things we're trying to achieve, and in the next few weeks we will bring you an update of that program so you can see what we're doing and where we're going. But it was really very encouraging that for a group of volunteers who meet for 2 hours once a month, that we have actually done as much as we have. And I have to say a very special thank you to Ian and people like Don who have done such a lot, but also to your staff here and to Martin. Gina and Chris have been wonderful. So thank you. I will now hand over to Don and he's going to talk about public health.
Thank you, Ian and Sandra. I feel thoroughly warmed up. Good morning, councillors. The Population Health Working Group was not expecting to appear before you today. We were originally scheduled to come on the 8th of May, when I had intended to report on progress with our activities. Oh, sorry, I think you've met Ron Tustin, who is a very valued member of our group. At present, we had our first meeting for 2025 yesterday, and 2 of our 5 members couldn't turn up, so we're still very much in the preparatory stage. The result is that our 2025 program is still being developed, and I think you have a copy of my note, which was essentially written for the working group to stimulate our discussion yesterday. But we would welcome very much any comment councillors might want to make on the population health priorities they see for the district, as it would be a great help to us in our planning. And in fact, it is likely to be a busy year, although at the moment there are a number of uncertainties which ideally should be resolved before we can determine where the opportunities exist for progress in health priorities, for public health priorities in our district. And as my note points out, the first of these uncertainties is government health policies. I was looking this morning at on the internet to statements by government ministers, and there was a very major statement on the government's health policy in July last year by then Minister Retty. But the only specific public health issue was that of immunisation of young children, but the general tenor of the statement was very much geared to thinking about public health issues. And the Minister made another of these, or made another reference rather to public health issues in a statement on the 30th of November when he told off the National Public Health Authority for a submission they'd made in a specific issue in Lake Wanaka, which had questioned the establishment of a McDonald's down there. But the Minister made very clear that that wasn't the sort of thing he had in mind, and he specified that there were issues like alcohol and healthy food and so on, which were much higher up in his agenda. Well, unfortunately, he's gone, as we all know, in a rather spectacular fashion, and the current Minister, Simeon Brown, hasn't yet made what I regard as a very indicative statement of what not only health generally, but although he has indicated his continuing support of the 5 health targets, one of which, as I said, is childhood immunisation, but he hasn't given us a very much in the way of detail about the government's approach to public health generally. And so we're still waiting to hear what the government's, if they can give us a more detailed statement on how they now see public health being pursued in our country. In addition to that, we're still waiting for the strategy that we've been working on in the health area. And as you very well know from the direction of travel document, which is a very good document on the whole issue of health in our district, and public health is clearly a major part of that, particularly as demonstrated by the list of statutes which require local governments to to take heed of public health issues. So we've started already looking at the detail in those statutes, and what I would like to do is to put together a document which lays out all of those responsibilities and then discuss them with the staff, your staff, as to how the council may pursue them. They will present to you, I think, a very complicated network of issues which have to be worked through, and not helped, incidentally, by the government's wish to get rid of the 4 wellbeings, because that was a major plank in the previous government's approach to public health. So both in terms of government health policy and in the strategy that the council has been looking at in health, we need to, if we're going to make real progress in helping you to make decisions about public health, we need more certainty in both those areas. I won't go through, since you have the note, I won't go through the detail of the other issues, but just to specify them, we were looking at alcohol, and Ron has a particular contribution to make, since he was on the National Alcohol Regulatory Body for some years. We're looking at tobacco and vaping, and we've been very fortunate in having joining our group during the year Mandy Savage, who is the local person in charge of the Cancer Society, and she's been a great help in helping us with a lot of these issues, including tobacco and vaping. And she and Ron had a very good discussion with Tim Costley, the local MP, to which they were able to take 3 young, very impressive young women from Paraparaumu College to assist them with presenting a case to the MP on vaping. We've got unhealthy food on our list of issues to look at. It's on the Health Coalition Aotearoa, which we've contacted, which is in Auckland, chaired by Professor Boyd Swinburne. And alcohol, tobacco and unhealthy food are the 3 major items on their list of examinees. Unfortunately, they haven't got any advice for us on how to apply their findings at district level, but they're very helpful in terms of establishing the evidence for action in those 3 areas. So we'll be looking at that in the course of the year. We've raised the question of vaccinations. I've already mentioned the fact that childhood immunisation is very much part of the current government's specific targets. But we would like to see that issue broadened to look at the lifetime vaccination program that individuals have to follow or should follow. And we've had, of course, a stimulus in that area by the COVID pandemic and our need to think about future protection against pandemics. But there are a whole range of other things, a whole range of other issues, rather, which need to be considered to ensure that our population have access to vaccination programs. Water management is clearly going to be something which will loom large for all of you in the course of the year, and not just in terms of public health, but the whole question of how councils can successfully manage the 3 waters, and that, as I say, will be one of your principal items of discussion and decision. And we would like to participate in it to the extent that it has a very important contribution to make to public health. Another issue that we'll be looking at is that of a regional public health forum, which Councillor Halliday has proposed. And we've had a meeting with him earlier last year. Our response to the proposal was that, first of all, Kapiti should be clear as to its own public health priorities. And secondly, we would like to make a contribution to it by talking to people in each of the other regions as to what their view might be of such a forum. I've no reason to think that it wouldn't be welcomed, but it just takes some initiative to get it started. And we've been asked by your staff to hold off on making those approaches to the other regions until you've determined the strategy. So when the strategy is in place, we would like to talk to the staff about the detailed implementation of it, including Councillor Halliday's suggestion of a forum. So those are the specific issues that we're going to, oh, sorry, there's one further one, and that's emergency management, which is one which is, you've already discovered over the last few years, is extremely sensitive, and certainly in terms of coastal management. We made a presentation to the staff some weeks ago, just before Christmas, on Barry Bullman, one of our members, is heading up a team from Massey University as Professor of Epidemiology, and they've produced some very interesting information on social vulnerability indicators, which are can be applied to making decisions in terms of what emergency management measures are in place in advance. And he made a very interesting comment in the presentation that in Otaki, for example, that if there's a severe coastal flood, a lot of the number of people who would be affected by the flood would be cut off from the health services. So there's an issue already which is emerging from some of this work. The rest of the issues that are in my note are essentially the management ones, so I won't go through those, but you can see there's a whole range of things that we need to attend to in terms of our database and our association with organisations both nationally and regionally, and of course with our own local NGOs. So there's any amount of work to be done in those areas. So that's it. Thank you, Chairman.
Thank you, Don. Ron, is there anything you wanted to add into the mix at all?
I guess my only comment would be that if I was from outer space, I was looking down on our health system, or in fact any Western health system, I would be scratching my head and saying, this is such an unsustainable business model. You know, how long can we go on just treating the sick without looking back further at, and we know already that heart diseases and cancers are very much lifestyle diseases, and there's lots of things we can do earlier in life to begin to hold off our illnesses and extend our lives. And I think you know this very well. I mean, the questions I've heard around from Ian's address was, first of all, where on earth do we find these doctors? And secondly, what about housing? How does housing relate to health? Well, it impacts enormously on health, in that both in terms of people talked about income, people talked about the plight that older people were finding as renters, for example, and bad housing makes us sick. So I think that, you know, you understand the remit that model by itself, by just treating the sick without looking at the other factors which Don's just referred to, it becomes so important. And the issue we have as a small working group, where 60% came to our last meeting, is that it's a huge menu and we're not that hungry to get through the whole thing, really. So that's the challenge we're going to have this year in terms of how we're going to manage that work and how we can begin to influence. But I mean, I was pleased to hear those sorts of questions coming from around the table today, that you seem to be very aware of that relationship. We can't just put all our resource into treating the sick.
Very good points, Ron. And you hit the nail on the head. I guess our challenge for the coming year is with this government and the well-beings and what the expectations are there. I personally can't see how local government can untangle itself from well-beings as such. It's just such a fundamental thing in representing our community with regards to trying to keep it healthy. And there's all sorts of different ways to do that through regulatory, but also through messaging, which is what I'm hopeful the Public Health Panel will be able to compound, and the messaging so that we can be a little bit more effective in that space. Do I have any questions from the table?
I could just comment on that.
Oh, yes.
Councillor, the two issues that I particularly want to look at is those of prevention and localisation. And I haven't seen anything in any government statement since the change of ministers, because if those, there've been constant references to them in the past, But until they're particularised and they're driven by some kind of policy approach, they won't actually become a practical reality. So those are two concepts which are fundamental to a change in public health.
Yeah, I wouldn't disagree with you on that. Jackie. Oh, sorry, my apologies. Nigel, I missed you there, sorry.
Yeah, thanks for that. And Ron, by the way, Ron's got a radio program on Access called Revive and Thrive, which everybody should listen to. It's got some really great local stories about all sorts of issues in health.
After the advertorial from
Yeah. Just also strikes me that not just Symbion Brown, but government in general, more and more the conversation is about private health rather than public health. And it seems to me that that's the direction that they want to head philosophically. So I'm just wondering about how, do you have a cunning plan for that? Because some councils, what they've done is they've said, well, that's where government's going, so we're just going to have to really go local focus and with councils, and obviously requiring more spend from councils for public health. So is that part of the thinking, or are you waiting till the strategy's done? And just on that, you know these strategies can take forever. I'd hate to think that that would be holding you up from having conversations with other entities. Do you know what I mean? I'm not saying it will take forever, but these things can.
Thank you, Councillor. As far as the first part of the question is concerned, interesting, I said to my doctor some months ago, I told him we were having this work done by KHAG and this public working group, and he was very interested in it. And he said, my job is to cure you when you come here sick. Your job is to prevent people coming to me. And so I got the message pretty clearly from him, that he does see the need for activity within the community, taking responsibility itself for its own health. And if the government is not going to do it, you people who are so close to us, it's up to you, I think, to do whatever you can to stress with our populace that they can't just leave it to their GP, especially since a significant proportion of them aren't registered. But they've got to really think about what they do themselves and taking care of their children. So it's not always easy, as Ron has already pointed out, in terms of housing. And there are other issues for those who are indigent and struggling. But throughout all of that, there's still ways in which they can take care of themselves and their children. And I think that's what we should be trying to do in terms of not opposing private health, but working with it. And I think that the work that Sandra is doing with the Kapiti Community Health Network is part of that as well. As far as the delay is concerned, no, we're not sitting on our, whatever it is, waiting for the strategy. We intend to get on with the job, but clearly if we're going to give you advice which you can act on, you yourselves have to make a decision as to what you're going to do with the advice. So we're going to continue to bother you.
That you finished, Nigel?
Yeah.
Excellent. Jackie?
Thank you. I see that you've got here on your list childhood immunisation has already been expanded out to a lifetime vaccination program. But if I could put my wish in here that unhealthy food be expanded out to unhealthy food and sugar-based beverages. And I would add, if I have my wish list, a provision of mental health services.
Sorry?
Provision of mental health services. Just noting the report we had last year on the shocking condition of the provision of mental health services for the youth. Yeah, thanks.
You might want to respond to that too, Sandra.
Yes, I would. Thanks, Jackie. Those are two really important points. But Dr. Graham Scott, who you probably all know, is heading up our mental health group, and he'll report back to you in the next couple of months on the work they're doing. But I mean, not that there's a great deal that groups like us can do, but he certainly has access in his new role as chair of the group to a whole lot of data and analysis, and he's been able to use those contacts to get some really good information about Kapiti. So we are starting to get good information and good contacts in that area. So again, fingers crossed we can make some progress.
If I may, just to add to that, yes, and I was able to share his last report with the entire Otaki Community Health Forum. Yeah, all their members, which are all their stakeholders providing health services in Otaki. They were really, really, really appreciative of his work.
On the question of unhealthy food, yes, that's, as you can see, is on our list of issues, but we actually haven't taken it very far as yet, and we intend to have a look at it further in the course of the year. Ron has already made contact with the Regional Health Authority and the person who's been doing some work there, although they're under strain now because many of them lost their job. So we're not quite sure. We did actually establish a very, very good contact with the Regional Health Authority in Lower Hutt, and luckily one of their best people is still there, but they've lost a lot of colleagues, and we're still working out as to how best we can continue that relationship with them. Ron has also been in touch with the person who's been looking at unhealthy food in terms of what a regional policy might look like. But we think that work has been suspended for the time being, and we're going to have to pick up in the next few months just what they intend to do about it. The interesting point about sugar-based beverages, there have been a number of comments in various data sources that we've looked at suggesting the whole idea of sugar tax. But that doesn't seem to be very popular with governments. So the question is, do we look at that? Is that something you want us to look at? You do.
Thank you.
Mike.
Thank you, Don and Sandra and Ron and also Ian. I just want to make an observation. I'm really pleased that you brought up about this removal of wellbeing. It's for so long and so many successive governments, this has kind of gone up and gone down and been removed and forgotten. If it's not up to government and local government to have a genuine interest in well-being of our communities, you know, what on earth we're here for? Every meeting that happens around this table is about how people live and how they interact with community. When we were at the local government conference last year in Wellington, the Prime Minister's opening address challenged this and said we should be there to fill up holes in the streets and make roads go faster and economy. But all that's nice, and nobody would argue about having a better balance sheet. But if you run everything by an Excel spreadsheet, then the well-being of people will be second. So I'm really pleased to hear, and I don't know how we solve that, because, you know, this kind of committee has its primary tenet, as we listened to the introduction from Morag today, that the well-being of our citizens and everything we do, from providing libraries to good access, is so important. So it's quite saddened that this current government is totally ignoring these parts of how we live and how we serve our communities. I'm just making an overall observation. So pleased for you to bring that up, Don.
The whole issue is to the emphasis is given by politicians both at local and national level is a political matter. Clearly Labor have wished to make an emphasis. The right of centre politicians think that it distracts people from looking at the essentials. So there's clearly a difference of points of view. In my opinion, I leave that sort of discussion to the politicians. What I'm interested in our public health group is the welfare of our people, however you define it. And I think all of you are the same. So I don't know that taking it out of the Local Government Act is going to make an iota of difference to the general attitude of local government. frankly.
Kathy?
Mr. Chair, I'd like to move the recommendations, please. We're doing that today? There's 2 recommendations?
No, sorry. No, that'll be coming to, that'll come through us as a recommendation. That'll have a paper attached to it, and will come to council as well. Yeah, that's a bit further on down the track.
So these are not being lost?
No. None of this is being lost. This is an update from the groups.
Right.
We've got a cycle, which we talked to last year. So there are 5 groups. So we've got a 5-meeting cycle where each of those groups just reports back and gives an update of where they're at.
Okay, I just didn't want these to be lost, that was all.
No. I'm sure they're pretty locked in, and that's what Ian's going to be socialising as such. But we have yet to discuss how we move forward with that as well. Cool. And Soka.
I was just wondering, we were talking earlier about like a sugar tax and stuff and doing these incentives, and I think I'm just a bit confused and probably just a bit ignorant, but I'm like not sure how much, like, can the council actually implement a sugar tax?
No.
Do we have the powers to do any of those suggestions? And
No.
if so, what's the intention of the conversation?
Yep, that's fine, Saoirse. It's a very fair question. And I might get Chris to delve into this one as well. But from the perspective of council, that'll be central government policy with regards to what they want to focus on. What we can do is advocate for the things that we think are important. Now, we have a social needs assessment and health needs, social and health needs assessment, which will evolve into our own strategy as well. And there'll be key things that we will that we want to advocate for. Idea will fall out of that. That might be one of them. That's yet a discussion to be had on some things that we might prioritise. After saying that, government does have a process where it looks at its strategies and there's the opportunity to submit. Council officers do keep a very solid eye on that. We tend to submit into a lot of things. And anything like that came along, we would certainly be putting a submission in. And I'm sure Capital Health Advisory Group would be putting a submission in, and there'd be perhaps the opportunity even for community boards, etc., to put submissions in as well. And part of what we'll be doing, in fact, maybe it's a point, Chris, any sort of health ones that are coming up, we might actually just indicate that to the group as well, just so they're aware of, or we are as a group are aware of what we are submitting into. Haven't really done any health ones recently, have we?
No. So I was going to make 2 points. The first is that I think the real opportunity we're creating for Kapiti with our, I'll say, reinvigorated engagement with central government is the opportunity to influence at several different levels. So whilst we do submit formally, there's also the opportunity to be engaging on issues topical for our district as advice is being developed, rather than waiting for something to be tabled and then commenting on that, which is what we do literally through submissions. So it's taking 2 bites of the apple. And I think part of the work that KHAG is bringing to the table, as well as the broader context that our chairs noted, is having an evidence base to say these are the issues that are important for us, which we haven't more recently had an up-to-date view on. So that's part of what we are working on together. And I think we're already seeing traction on several different issues. And the more we're engaging, the more demand there is for it actually. So it's quite a positive step. And absolutely, we do circulate around all submissions that we are making through the elected members bulletin, and we are putting up on our website. If it's useful to also perhaps 6 monthly check on those in this forum, we're happy to do that as well.
Yeah, sorry, I forgot about that. They're very comprehensive from the EMB, to be honest. And if I was to use a comparison, Sorka, with regards to a piece of work we've already done, that would be the housing needs assessment. So we needed to prove need to central government, but it needed to be fact-based, shall we say. So we went through the housing needs assessment. Argument could be whether we should do that or not, whether that should be something that central government should do, but coming back to the conversation we're having about what's important for us as a community, do we sit back and wait for things to happen, or do we step forward and empower them to happen as such? So through our housing needs assessment, we're then able to prove need to central government, and that's why Kainga are now building houses here. as such. And it will be the same on the health side of things as well. So we'll stock take what we have, we'll decide what we need. We can do advocacy for that, or groups in the community can do advocacy in that space as well. But what we will do is we'll have good data and good information to work from. Is that a fair comment?
Yes, great summary.
Cool. Jackie?
And
Oh, sorry.
one thing that councils can do, in taking a leaf out of the book of the great, very successful smoke-free national campaign, which I have to say, Martin, the smoke-free campaigners at National Conference were very, very supportive of all of your actions in bringing Kapiti's smoke-free levels right up to some of the top in the country. But we can declare some of our parks and reserves and facilities to be sugar-free zones, and that is a really, really great way to change public behaviour without waiting for politicians to change legislation.
Yes, interesting comment, that one. I think it was the first local government conference I went to. We had one little box compared to everybody else. So we've been able to bring that up, which was a good result. Johnny?
Yes, so thanks for coming along, and I've been listening and heard a few things like, prevention's better than the cure, and you go to a doctor to get cured, but your job is to sort of prevent people from actually getting there. And of course, I guess as a nation, we do have quite a few people at the, of lower socioeconomic groups or poverty and stuff like that. And I guess there's poor outcomes for those sort of people. How do we compare with other prosperous nations, or have you done any work on other prosperous nations and how their health outcomes compare to New Zealand? In prevention and as of outcomes. I mean, from my understanding, more prosperous nations, well, it depends on how you look at it. They probably eat well and maybe have more heart disease because of obesity levels and things like that. But I think nations that are probably more prosperous have a healthier population.
A great topic, because certainly we've looked at it recently in regard to food, and because there's been quite a lot of traction around the school meal issue, and that's opened up a bit of a debate of what do kids do in schools in other countries. And clearly there's been an example, one in France and in Japan, where they have a very controlled, as you'd expect, a very controlled system for school lunches, where there's a lot of learning around nutrition, etc. But then you look at the life expectancy in Japan, and it's considerably longer than ours. So, I mean, if you look at it in terms of every issue, you can probably see how we fit. As an affluent country, you're right, we're up in that middle cluster. But, I mean, it really just depend on which issue you look at for some things. I mean, apart from very old people, and there's something called the blue zones, and these blue zones were created by someone using a blue pen and circling these areas in the world where people were living beyond 100. And there were all sorts of things. Some were leading very healthy lifestyles in terms of exercise. They lived in houses where there were stairs, all sorts of issues like that. There were different things for different groups, but the one thing that got people to live longer was the fact that they had something to jump up out of bed for in the morning. That was the one thing. So, I mean, it's a very complicated question, and there's no one answer really, but it certainly needs to be addressed.
Does that get you anywhere?
I think, John, if we could have Johnny's mic back
Yeah,
on.
yeah. No, it's a very complex issue, because health sort of starts at exercise and food and all those sorts of things, and I don't think mandating or sort of putting sugar tax on or sort of forcing people to sort of make healthy, forcing people into those things is the right way to go, because we've also all got individual responsibility for our own health.
That is true to an extent, yes. I'd agree with you. But some work on public health is pretty uphill. I mean, people are opposed to things like the super tax, for example. But the smoking legislation was an example where it was effective. So, and the reduction in smoking among the young was quite spectacular before the legislation was rescinded, and that presumably was why the Mayor wrote to the Minister and expressed her disappointment. So I guess it's a matter of judgment. I mean, evidence is hugely important in all of this, and the extent to which you can actually prove to people that you're not having them on or creating a fuss, but you actually, there is evidence there that if you do A, B follows to their benefit. I think that's where we're going to try to put our emphasis on trying to persuade people rather than force them through taxes or some sort of regulation. However, you do need regulation, and a good example is that one of our members, Mandy, is about to appear at the hearing in Waikanae for the licence, the alcohol licence. So, and we'll be opposing the extension of the licence. So again, it's a matter of judgment. Is that going to help or not? And you're sitting in the seat where some of these judgments are going to be absolutely essential. Sorry.
And Rob. And I think we'll wind the questions up after this one. Who do I?
Oh, thanks, Martin. Yeah, thanks, Sandra, Don and Ron, for coming. It's been a bit of an eye-opener. Now, Saoirse, you just alluded to, sugar and the control the councils can have, and we've been talking about council being close to the people, the community, and I think we've just had a bit of a bite of the cherry with regard to housing needs assessments and these new developments and the living environment. We're into having a healthier living environment, and there has even been talk of an urban panel being formed to sit down with the developers before they go ahead and make sure we have open spaces and good connections and sun coming into the houses and that. So the council is looking positively, forward at the living environment. Anyway, thank you.
Good on you, Rob. And great to see the urban panel coming up. And look, I guess what that emphasises is a simple fact: there is no silver bullet here, and hence why we've got 5 different groups working on substantial areas that we need help in. But we just keep chipping away and try to be as positive as we can and use the tools at our disposal. I guess one of the frustrating things always in council environment is sometimes the time it takes to do things, but we want it done right, we want it done solid, and we want to make sure that we can enable some positive change for our community. And a lot of it is awareness, in my opinion, and the younger we can make people aware, then we can set up habits for life, so to speak, or at least people being aware of the consequence of what it is they're doing, which we don't until the health issues start turning up later in life as such. Well, thank you very much for the presentation. Much appreciated. Love the different groups that come in from the Capital Health Advisory Group. Always find it very, very informative. So thank you very much for updating us today on the regional health side, and Ian as well on where we're at with the compelling case as well. Look forward to seeing you in 5 weeks' time, Sandra. Well, actually, more like see you before then. Thanks, Don. Thanks, Ron. Right, that's deputations. I'm going to skip members' business till after updates and ask who we got here, Jason and Abahis, if they could please come up. What we'll do is have that presentation, we'll have a coffee break, and then we'll go into progress updates and general chit-chats if need be. Oh, crikey, Charlie. Yeah, 16 espressos. You can think you can fit in there. Urban panel design concept. Good gosh. Good gosh, Rob. Eh? A time coming here. We do have a paper on this that does have a couple of recommendations as well, but your tenacity, Rob, is seeing this come to the table. Good on you. And I give council officers the floor.
Kia ora. I will hand over the team, but I think I just wanted to set out that this has been a long time coming. When we were deliberating on Plan Change 2, intensification, there are a series of follow-ups that we said we would come back on and that we wanted some time to look at that. I think you all know that we have been working closely with Rob around the Urban Design Panel because of his interest in that, and this group had indicated that we should do so. So it's a pleasure to be able to come back and share with you just our initial thinking around this and our proposal for next steps. And just to note that we have pleasingly been able to leverage on an appreciation of what's happening in other jurisdictions, so outside of New Zealand, as well as looking at what's happening in New Zealand. You'll see there's quite a bit of reference to guidance that's available from the Ministry for the Environment for your information. So we are not the first district to look at this. And in some ways, it may be that now's the time, and it's a great opportunity for us to be really unpacking how this can help us as we step forward. So we just wanted to ensure that we'd put those intentions on the table. We are looking for some noting, but also endorsement today that we continue to progress work around establishing the urban panel, and that we'll be coming back with some advice. So the team here has got all the goodness to step through with you and to answer any questions. So I will hand over, but just want to say quite an exciting day to be coming to the table, and I think a really positive step forward in terms of the opportunity to think about how we grow, which is something you've indicated us that's very important, and we are focused on that.
Kia ora koutou. Thank you, Chris, and elected members for considering this paper. I really wanted to introduce you to Apas, actually. Apas is an intermediate policy planner in my team, and Apas has been working hard on this area for some time now, and has built up a really good understanding of what's happening around the country, and has done some really good work to pull this paper together for your consideration. Chris mentioned the timing is right. I very much agree with that. As you know, there are growth pressures. That's actually a good thing for a district to have growth pressures. You sure as heck don't want it to be the other way. But with that does come some need to respond to how to grow. And we have heard, as you all have from time to time, a new development is proposed in an area which has been used to things being the way it's been for some time. And there has been some growing pains in different parts of the district. So we actually do see as staff that this has some potential to, I guess, give confidence to communities around the district that council does prioritise urban design. Looking forward to the conversation today. Thank you.
Fabulous. Guess we'll take the paper as read. Any questions at all? So moving forward to Kathy.
Thanks, Jason and Chris. I did read somewhere and I can't find it on the paper, but I've got on my notes sustainable development. Now, what does that actually mean? Because we've got a community board meeting this evening, and I understand we have some residents coming from Otahanga about a development in Ratanui Road. So I just wondered, in terms of this, what does sustainable development actually mean?
That is a very deep question, Councillor. So the Resource Management Act has defined sustainable management for a number of years. If you ever wanted to read Section 5 of that Act, you'll basically see it's a balancing exercise. It is about providing for things like economic growth while you're also needing to protect the environment in its most basic form. So and this is why it's an interesting conversation to always have, because different people have different weightings on different elements of what is the environment, including people. I'm not sure I can say much more than that. There's not really if that was easy, resource management would be easy and district planning would be easy. And as you know, it's just not.
I might just add to that to say, and I think Jace has quite rightly referred to requirements set by the RMA and other legislation around land use. The other side of sustainable development as a concept is making sure that as we grow, we have the services we need in the community to ensure that our communities are supported and that's supported to thrive. So some of the conversations we've had with you around, do we have access to health services? Do we have the community support that we need? Do we have community and social infrastructure? That's also the other side of sustainable development. So it's somewhat, Kathy, about where you look and who's talking about it. But the concept of it is that you grow well, you grow the things you need in the community to make sure the community can keep going in a really strong and positive and thriving way.
Thank you. Yeah, no, it's just that I've been here since it was only half a dozen houses and the place is still good. So thank you.
That's a long
Nigel.
Yeah, thanks for the paper. It's been a long time coming. I have a concern, and that is this really, it's excellent. Right? I don't want to get that confused, but this really feels like kicking the can down the road. There is, this is happening already in the country. Nelson, Tasman, Tauranga, Hamilton, there's a whole bunch of councils have already got this. So I don't see why somebody doesn't get on a plane, go talk to them about what they've got. That's great, let's do that, adapt it or whatever. The pace of development in Kapiti is really significant. I'm concerned that in 12 months' time, when we've got a panel or something, that then we start doing stuff. And I think there's a need to be doing it now. There's been a need to be doing it for years. And I think of the Utata Street development, Moy Place, in Otahanga, there's a conversation going to be happening there. We've got huge development down on Kapiti Road with the Wellington Company. So where is the public voice in what these things are going to look like? And so I'm just really concerned about the timing. And I know things take time, but again, there are living examples around the country where this has already been done, and my understanding is, and I haven't researched this anywhere as much as Rob has, but there are places where this has really been done well. So why don't we just, the councils tend to reinvent the wheel on these things. I don't know why we just don't go have some conversations with people who are doing it and say, well, yeah, we can work with that. Yeah, anyway.
Thanks, Councillor Wilson. I think perhaps the good news is Haas has done that. So he's been looking around the country, chatting to people and trying to pull together the best bits of what people are doing. I think part of what we've discovered and we've tried to highlight in this paper is it's not one size fits all. People are doing slightly different things because of their settings. And so what we want to make sure we do with you is put together something that's fit for purpose for Kapiti. Definitely not, I need to say it the right way, we are trying to do rinse and repeat from the perspective of learning from others and not trying to start from scratch. So I think that's an important thing to note. I think secondly, this paper does talk about some considerations around needing to really clarify in terms of reference, the funding resources and the membership. So working through with you guys. And I just want to say importantly, in the interim of standing this up and working out where it fits in our current system, we aren't doing nothing. So we are engaged with developers. we are ensuring that we're putting forward our base expectation and need, and there is conversation. I think this mechanism merely formalises it, strengthens it, and ensures that there's clarity for all parties around how we want to do that going forward. So just to address the concerns you have, because I do understand the points you're making, is we are trying to bridge the gap, but it's a plaster, it's a band-aid. It's not something that's going to permanently help us, and I think this is that actually we get on top of it and we head forward. So that's the intention. So I just wanted to make sure I clarified that. I just want to test, Jace, did you have anything you want to add? No?
And then just quickly, I know we're engaging with developers, so that for me is something of a concern, and if we are not also engaging with the communities and where these developments are taking place, and that's the feedback that we're getting. Narara Road, a developer came in, bought a property, chainsawed down all the trees, and now is building 21 units in a residential street. And now people are kicking up a fuss, and it's all too late and yada yada. So this is, like I say, this stuff is happening apace, and we need to be engaging with the communities, because the communities are engaging with us as each individual little disaster happens in their area, and then they engage with us. So this isn't just a feel-good thing. I think there's a real practical value to having this, but sooner the better for me. And I don't even know that do you have to wait until you've got the whole thing together, or can you start doing stuff incrementally? And that's perhaps another...
I think, sorry, I'll just jump in there, Chris. One of the things that the wild card for us, Nigel, is this government legislation. That Narara place is a classic example. We had legislation, we had things in place. We had a garden precinct in place, and PC2 took that all away. And then we're scrabbling now to how can we put another protection in place, and one that's perhaps a little bit more enduring than has been as well. And look, people do get the opportunity to feed in through submission processes and that sort of scenario. So I think it's not necessarily all one-sided towards the developer. We've got obviously a regulatory obligation there. But after saying that, you did right. There's we always know we've got a community that's wanting to state their point of view, and they have been, and I can't see that slowing down at all. So I think what we're doing here is a good way to combat that. That's going to be the timing issue, as you well, I think correctly pointed out.
I think just to add to that, while she was speaking, Councillor Wilson, I think it would be useful to come back to the table with you guys and just talk about the mechanisms we have that we are pulling, because the reality is some of the settings are currently enabling some things to happen. So without getting into examples, technically, developers not doing anything wrong, but in terms of how we're trying to grow, we maybe don't have the bits of the puzzle there, and this is one of those gaps. So this is not a silver bullet that's going to solve every single issue we have, but it's one element of the suite of things we need, which we don't have. And I think that's what we're putting on the table, with a note that we will take away, that we'll come back and talk about all of those levers so that we can have a discussion about, hey, are they calibrated in the right way to give us what we need? So that's part of what I think we'll be getting into between now and July with you guys.
Just a quick bit of clarity there, Chris. I think coming back to council with regards to a workshop or briefings and that sort of stuff, will they be happening before, or that going to be happening as part of this process?
Yeah, so we are going to be coming out and talk to you about our master planning program. And so the piece I've talked about putting all the bits together and going, are we there yet, effectively, and where are the gaps, and what's the priority for filling those, is something we're going to be working through. So that'll be a series of briefings. Some things will come to this committee, some things will go to Strategy Ops and Finance. At this stage, unlikely to go to council, but we'll be starting to push that program through and set that out with you so you can see the pathway through this year.
You appreciate some time frames around that. Johnny?
Yeah, my question is regarding the panel, and whether there's going to be sort of like a code of conduct for the members of that panel, because we've had panels before where we've had a little bit of an issue, and I notice in the report there that the Christchurch Council has a code of conduct for their panel.
I think I can just note that last year there was a conversation where Council Operations were asked to clarify expectations for panels and other bodies and to establish a generic code of conduct. That's now in place. So all new panels and forums that are established with the terms of reference, there's a code of conduct that goes alongside it. So that previous issue or matter has been addressed.
Excellent. Lawrence.
It's great to see this part of the puzzle, I guess, starting to come. I've heard a lot about it in the last 2.5 years. In fact, every time one particular fellow councillor, who I won't name, speaks, tends to somehow get an urban design panel into his talk. So that's great. I've just got a question, because I guess for me, in terms of the challenge that sits in this space, is there's a lot of legislation we have to work from that is central government dictated. Do we feel that there's enough room for us to effectively create this panel, that it's going to be able to do what we're asking it to do within the legislative framework that central government seems to be shifting all the time?
Mm.
Or are we barking up the wrong tree, to use an analogy? Maybe.
Everything is connected in this space. So if we're just talking about the now, we have a district plan that has been adjusted by PC2, and it has, I guess, enabled more development to occur without needing a resource consent than before. It was deliberate to enable more housing capacity, because actually we probably do need it. But we'll talk later in an upcoming committee meeting. I think it's potentially scheduled for the 20th of February, actually, a talk about the implications of the RM Amendment Bill and ratification decisions and special character areas and the like. But at the moment, you can do a lot of development as a permitted activity, and the urban panel is not under no jurisdiction that I'm aware of. Does it ever wander into giving recommendations on things that don't need a resource consent and in the sense of the district plan? So it's not going to live in that space. And if council wanted to lower that threshold and bring more things into the consented realm, then it potentially could open the door for an urban panel to look at more. You'll notice in this paper, and probably more so in the appendix, that where the threshold is for where the panel operates is something that every council has worked through. And typically, actually, they won't have the panel look at every single consentable development, and you can imagine why. You know, your infill type things where you're putting an extra building on the back of a property or something is probably not really where the action is for a panel. It's more likely to be in the kind of larger scale development. So one of the things to work through with council is going to be, where is that threshold? There are other things outside of resource consent processes that an urban design panel can aid council to do better at. And you'll look again at some of the examples that other councils have done. Things like private plan changes and structure plans. They could potentially have an advisory role, so slightly bigger scale. Also council strategies, growth strategies, master planning type initiatives. So actually council initiated work, they can live in that space potentially as well. So there is a lot that council could get an urban panel involved in. This is one of the decisions for council to make. There was, I think, a suggestion around, could we get started a bit earlier if we staged what we get them to look at? That's something that we can look at, and have actually, I think there is a brief mention of that in here as well. Ultimately, it all comes down though to budget, and how much you get the panel involved in is going to have a direct correlation to how much it's going to cost. And so then that ties into the decision around who pays. And you'll see from this paper that typically the general ratepayer pays, because if you want this thing to actually make a difference, you want developers to be going, I'd love to use the urban panel, as opposed to groan, here's another thing that will slow things down and add complexity and cost. So a lot of things for council to work through.
I just want to add one more thing. I think I might hear you querying our national settings as well, which seem to be in a continual shift space right now. I think the important thing about the urban panel construct is that there's an urban design protocol that's been set nationally. And so this is actually part of the framework. It's not a would you like it. I think we've given you a link to the protocol, but I think it's worth just noting that this forms part of the government's Sustainable Development Programme of Action. And it's not an add-on, it's when you bring the different components of requirements together from things like the RMA driving intensification to, hang on a second, we've also got a protocol that's been signed at a central, local and more broad level to say we want to grow well, because that's a construct I think we're operating in. I think given that we're one of a few councils that have already had a conversation about intensification and actually pushed through to having a district plan change, this becomes so important for us to also stand up alongside that. Without it, I think our settings wouldn't be calibrated appropriately. So part of the reason we've shared some of the protocols, some of the guidance, some of the toolkit that actually sits alongside this is it's not new, we just don't have it. And we're saying to you, we think it's a really vital and important part of our next step. So irrelevant as to what happens with intensification, we need this now because we have a district plan chapter that talks about growing up and growing. And so this is just that check. So I think it's got teeth. It has a protocol. It's accepted as something we should be doing. And these settings are set by the same people who are looking at intensification. So it is combined. We've just never talked to you about it in quite the way we are today.
My second question is probably an expression of a little bit of concern in terms of how we talk about this particular piece of work, because I think we're probably super aware, one, we need more housing, but two, we need appropriate housing that's suitable for our district and the needs of our communities. My concern about any conversation around this is people who are involved in that space around housing development are going to potentially see this as another hoop I've got to jump through and another cost that makes housing not more affordable or accessible but more expensive. And so I guess my question is, are we confident that how we're presenting this or even how it could roll out, people see it as being, or people in that space of housing development will see it as being an asset rather than a barrier that we're creating?
I think those are really important points to keep top of mind, not for this particular piece of work, but as part of a wider piece of engaging our developers, our planners, our architects, and others who do engage in the space. I and some of the other GMs at council are touching base with many of those groups to understand what's working well and what's not, and testing as we move forward and we start to develop things, the appetite to actually bring some forums together to talk about how we do this well. So it isn't just councils pop something up and you will do these things. It's to understand what would be useful, what would make things hard, and how do we think about that as we design our way forward. I've got to be honest though and say, I actually think this is a frustration on the other side, which is a bit of an insight I'm going to bring back to you, is at the moment it doesn't feel like there's anywhere to go to have this conversation. And so having a spot where you could go and say, hey, look, we're thinking of these things. Will that fit in? What does it look like? I think I've heard back from some planners, from some developers, that this would actually fill a gap, depending on how it's set up. So how it's set up really matters, and doing it in a way that meets our needs, but also ensures that it isn't another roadblock or seen to be sort of like a delay. So how long is a piece of string? We're not proposing that it does that either. So we're going to have to really think hard about how we move forward, which is why we're proposing to take some time to set it up, because we want to do it well and do it right, not have to try and U-turn and then because it didn't work, nobody wants to engage in it. So we think getting it right is really important for both sides. So I think those are really important things to keep on the table, because I think there's good intentions on both sides. So as we come forward and we talk a bit more about our regulatory space and how we might be thinking about how we work more with the community who's involved in the space, I think we're going to sort of talk to you about what does that look like and how might we need to shift slightly to create that space. So that's front of mind for us, and a great thing to table here, because we're really focused on it and will be this year coming back to talk more about it.
And my last comment with your leave, Councillor Halliday, I think for me, well, we can obviously talk about cost. That's got a decision that has to be probably top of the priority and who pays that cost. But I think the most important thing, just re-emphasising a little bit of what Councillor Wilson said, is hearing the voice of our community and reflecting that through this panel and through the settings in our district plan. I think if I'm hearing anything across our rohi, it is that people want to feel heard around the conversations around how development happens, what that looks like to my community and how that feels in my community. And so I think as we take this journey, that also has to be part of the conversation on the setup of this panel, is that somehow that reflects or is connected to the views of our community in that space as well. So I guess that's just an observation more than a question. Yeah. So thank you. It's exciting to see this paper come to us, at least for our first conversations.
I just wanted to note that it's a really important consideration, and as we come back, we'll make sure that we specifically touch on that point and how we're proposing to move forward.
Michael.
Thank you, Councillor Halliday. Look, I first want to applaud Councillor Cofort's tenacity on this and the staff who've done extraordinary mahi on this. Now, coming from the most rural part of our district, it's odd that I might want to contribute to this conversation, because, you know, we don't have urban high-rise going around Te Horo and what have you. However, it will probably happen one day.
Give it time.
I think that's where Councillor Wilson will retire eventually with his fishing rod. But my question and concern is how this panel, once up and running, might affect fast-tracking, and how that might imply a change in discussion from developers. It doesn't go unnoticed on us around here about the Waikanai's Garden Precinct challenge on intensification. We can't ignore the conversation we've all had around this table since late November on Moy Place. And I know we don't want to talk about specific developments, but I can't help but think if something like this panel was in place, 2 years ago, and the new owner of that land up in Otaki sat down with community, we would have an entirely different outcome. So the challenge of these kinds of things is to manage it, and as Lawrence has said, that we won't have this concern from developers getting frightened about how they approach these conversations, but they'll have a better outcome, and it may not slow down and increase bureaucracy, but it may avoid big challenges, and like we've got currently before us with Moy, we may not have to get to that position. So I'm just trying to add to the conversation around that, and how this would sit on a government imposing a fast track, and how a good conversation with an urban panel might navigate through that. And you know, one comment I made loudly around the Moy conversations was that it'd be good if a developer was a good neighbour. And if they were a good neighbour, they probably wouldn't make some of those decisions, and that they would get their bulldozers onto these lands a lot quicker. Thank you.
Thanks, Mike. I just wanted to point out to everybody that, I mean, we mentioned this at the beginning of the triennium. I'm pretty lenient with regards to us discussing this rather than asking specific questions. Just wanted to point that out. There's no, I don't have an issue with that as such. But Rob, I just would check with you. You'll have first right. You'll be moving this motion.
Yes, well, I
and,
was just going to, attempt to move it.
Oh, look, well, just there's a couple more. It's good to get some questions out
good
because
questions,
because
I did have a comment, but yeah.
If you want to say the comment to you, because you'll have
Yes,
the
I'll
right
save
of
that, yes, yes.
right of introduction, so to speak. I think it might be more appropriate there, if that's cool. Guy. I see you there, Hirawai.
Yeah, thanks, Lapas, for your excellent paper. One thing which would concern me, this will become another layer of bureaucracy in terms of development. But more my question is, do you prefer to see this coming out of general rates rather than user pays? And I'd just like to say as a comment before you answer that, I think it should come out of user pays. I think ratepayers already have a huge burden on rates, paying rates, and we need to reduce rates, not add further costs. So my preference would be, it should be towards user pays. Thank you.
If I might just note, because obviously in our paper that was one of the key considerations we think we need to work through. The intention of engaging our development community, our architects, our planners, actually the business community as well, just more broadly in terms of a community input, is that if we put something in place that's useful, a user pay model has better legs to stand on. So it depends what it is that we want to put in place as to how that option lands, I think. So that's what we want to do some due diligence on and come back to you on. So some of the feedback I've had from some planners and developers is if it adds value, they're happy to pay. If it doesn't add value, then they don't see why they have to pay. So I think we need to find the sweet spot in that point, but we definitely wanted to come back with some thinking around where that sweet spot is in terms of the balance that you might want to take forward. So that's why we think there's a bit more work that needs to be done just to understand where things are sitting in this district.
Cool. Now, I just want to acknowledge Hirawai and Sophie, who are online. I didn't do that beforehand, but Hirawai, you had a question.
Can everyone hear me?
Yes.
Sort of just two questions I had. The first one was in the, I guess, was it paragraph 6.1, we talked about sort of the initial benefits from consultation with other councils. I just sort of wanted to understand whether part of those benefits, sort of their efficacy, whether that also included faster processing of consents. I mean, it talked about sort of adding value and those kinds of things, and streamline consent. I was actually quite keen to understand whether, or maybe it just hasn't occurred longer in some of those panels to actually kind of get a good sense of that trend, because that will probably be part of that value add component for developers. And then the other part too was in their consultation with the councils, did they also raise what sort of challenges they might have had? I mean, you might have alluded to before, you talked about just needing to fully understand and define the role of councils in that process. But that might be something that gets a bit more flagged either in the April paper or not. And then I had a second question around if the, actually not still a question first.
Sorry, Hirawai, we just can you just sort of maybe clarify the actual question succinctly?
In the paper where it talks about some of the benefits in the consultation with other councils, I was sort of keen to understand, was there any consideration raised from other councils about whether it lead to faster processing of consents.
Yeah.
Like, because like you talked about streamlined consenting, but I was wondering, I just wanted to make sure that actually include like faster processing, because that would add to the
speeding
value.
process.
Yeah. Okay. Thank you for the question. And Abbas, if you actually have any recollections of specific conversations that you might have had with councils, do feel free to shout out. But I think, yeah, that 6.1.2 was talking about streamlined consenting processes. And my understanding of that is that essentially by spending a little bit up front of time and planning it right, down the track when it comes to things like requests for further information, and also, I guess, the risk of communities pushing back on a particular proposal and that causing delays. If you spend a bit more time up front, you can actually save a lot of time at the sort of middle to back end. This is all anecdotal, of course. We don't have statistics or anything like that. They don't exist that we're aware of. But we are reaching out. We've talked to a few councils. We've got more conversations to have. We talked with a associate professor at Auckland University, I think Lee Beattie, very, very helpful, and shared his experiences with the Auckland Council. Much bigger exercise up there. Panel of something like 40 odd members. They pluck different groups for different purposes, versus your smaller models, your Taurongers, sort of Christchurch in the middle. There's a wide range of experiences. The fact that they've kept going with panels, some of these councils, for over 10 years tells you something. If it was a dog, you'd want to stop it barking, and it obviously isn't a dog. So there must be benefits that these councils are experiencing. There are also councils now that have had it going so long that they've actually started reviews and are doing second generation improved processes, and that's where we want to get the good oil. We want to be able to start with 2025 best of, as opposed to 2000 second rate. So we're in a good spot.
And then the other sort of question, but I think you might have alluded to, was that is there a point when consideration of a point where either these panels will no longer be needed because the capacity, right? There was the issue is that the capacity isn't there within council currently. Like, is there a point where we would no longer need the panels, or was the view that we would kind of continue it and then just reassess and review that point every couple of years?
I think inevitably there has to be a review process built in to this to reflect on its efficacy and to improve it where needed. So I think you could lock that in, that staff advice will be going forward that should be built into the life of the process. We do note also that some panels have actually had, as maybe more common actually, panel members have had a period of time, say 2 years or 3 years on the panel, then they have to step down and you have some freshness to it. So there's lots of ways that can be built in to make sure that the panel stays fresh, stays focused. And remembering, if there's no projects for it, it doesn't do anything. So it's not just sitting there racking up a gigantic bill doing nothing. There would be panels that would be called upon for specific needs as they arise. And Auckland actually reflected to us through Associate Professor Lee Beattie that at any one time they might have like 15 panels on the go up there or more, plucked from their mega group of 40 or 50, and they will pick membership based on the actual needs of the project before them. So we're not actually necessarily just talking about, and this is a learning that I've had, one panel. We're actually talking about a pool of people with different expertises that you would pluck depending on the particular project that the panel could add value to.
Go there, Hirawa? You okay with those answers?
Thank you.
Yeah, very good questions. Thank you very much. No other questions as such? I did have one, just before I go to you, Rob. A2 talks about endorsing progress work to establish an urban design panel for the Kapiti Coast District. Fully appreciate we're getting to a decision point around moving forward, but I do wonder whether something along the lines of endorsing progress work to investigate establishing an urban panel. But after saying that, what I'm hearing today is that this is actually very beneficial as part of the process of growth and development. That is something by other councils. So I guess our question is, are we pushing this forward? And our recommendation to the social to the soft committee as such. Yeah, splitting hairs maybe, but after saying that, I'm actually, and after the conversation's just been had around this table, I'm quite happy to leave it as it is, but I just wanted to float that around for some discussion as well.
I would suggest let's table a motion and debate.
Yeah, why don't we do that? Sorry, guys, but I would like to foreshadow
Thank
with
you,
regards
Chairman
to
Martin.
that I'd like to move a motion with regards to changing the wording of A2 from endorsing progressing work to establish an urban design panel to ensuring progressing work to investigate establishing an urban design panel as a view from the table as such. I don't think it needs to be written up at the moment, but I'm happy to discuss it as such. Could I have a seconder? Oh, sorry, I'm not going to ask for a seconder. That's a motion I'm putting forward. Is there a seconder to see that move forward into discussion at all? Is that the correct process for doing that? Okay, so why don't we have a quick coffee then? We can get that on the table and come back and have a quick discussion around that. If you're okay for that?
Well, can we just move on, Martin? I think we could bypass that.
No, it's the whole point of it being something that needs to be discussed. And that sort of stuff. And look, there's a very good chance it will fail, Rob. It's not going to slow this process down, but I think it's worth. There's quite a distinction between us saying work to establish an urban design panel versus investigating the establishment of an urban panel. We're sending a. So I just want to test the table with regards to our position on that.
No, I think we move ahead and get on with it.
You'll have one vote, Rob.
Okay, well, that's my vote.
Cool. Give it a predetermined. So we'll just get the wording sorted out for that. We'll put it up there and we'll have a coffee in between. Okay? Okay.